We've been discussing mental health and dealing with stress on tonight's show. Well, my next guest is the founder of the Thriving Center for Psychology, which offers over 85 qualified hand-picked therapists to help people find their ideal client-therapist relationship. Dr. Alexander Alvarado joins me tonight via Zoom. Welcome to the show.
Thank you so much for having me.
Absolutely. Talk about your passion, why you started the Thriving Center of Psychology.
Yeah, sure. So, I started myself in New York City and kind of branched out from there. One of the, I think, big things that I've been trying to really help solve or help with is helping people find qualified therapists. I think a big piece of when people decide it's time to go to therapy, there's that overwhelming, where do I go now? And we're in a really interesting time where there's a lot of resources out there for mental health, which is great, but that poses some other problems, such as, what resources are trustworthy and where can I find a qualified resource?
Yeah, and how important is it in that process of matching the right therapist with each client? Because, again, you're going to be opening up, talking about personal things, so finding that right fit, how important is that?
They say rapport is around 70%, of what leads to successful outcomes for clients and their therapists. So it's very, very important for their fit.
Makes sense. And I understand you also are now offering telehealth appointments. Is that something since a pandemic, and is it something you plan on continuing to do moving forward?
So actually, telehealth has been around before the pandemic, but the pandemic just really helped telehealth explode to another level, where primarily I would say a lot of people prefer telehealth, and that depends on locations. We have a few locations. New York and LA are two of them. New York, we've had a bit more people ask for in-person just because they don't have as much at home places where things are private. Maybe they have roommates. In California, we haven't heard a peep of people wanting to really come into person just yet. And I don't know if you've ever been to LA between 5 and 7, which is probably the highest times people want to seek therapy. It's not fun to drive anywhere, especially a doctor's office.
No. In fact, when I make my business trips to see our studios out there, I always plan around the traffic time. Now, you mentioned New York and LA. You have other locations in Miami. I'm kind of curious, do you find that the care you offer, is it different or is it pretty universal?
So the care we offer is pretty universal. We make sure all of our therapists utilize treatments that are backed by science. I know it's kind of interesting to hear that there's some therapies out there that are not backed by science, but there's a lot of different therapeutic interventions, and they all vary in terms of research. So we really make sure that there's consistency throughout all of our practices. The one thing that is different is probably people's ideals or stigmas toward therapy, depending on which location we're in. Places such as New York and California, the stigma tends to be a little bit lower, and people are more open to therapy. We found Florida is people are still, of course, open to going to treatment, but the stigma is probably more there than other places.
That's interesting to me, and hopefully, if there's one positive, and we've talked about it even tonight on the show, if there's one positive coming out of the pandemic, is that we need to understand it's okay to seek a therapist, to seek help. We've seen it on every guest we've had tonight. They've recommended meeting with the therapist. So because of the nature of the subject, for someone tonight who's watching, maybe they've found the show for the first time or they're a regular viewer and they're struggling, what advice would you offer that person?
Sure, yeah. So I think a good rule of thumb of to when to see a therapist is if you've been thinking about seeing a therapist, chances are it's probably time. But then it's the next step of, okay, now what do I do? And so I think there's a lot of areas and resources you can go to. Google's a great place to start. A big mistake that people make is making that the final destination, right? Just because someone is the best promoted on Google doesn't necessarily mean they're the best therapist or best therapist for you. Also, taking a referral, I think it's a great starting point, but it shouldn't be the end of the road there. Just because someone, maybe a friend or family member went to a therapist that was great for them doesn't necessarily mean it's the best person for you. So I would highly recommend making sure you speak to any therapist that you might decide to see. I think there's some things that you should ask them to find out if they're the good fit for you. One of which is what they treat and their specialties, if that aligns with what you're coming in with. A big piece is how comfortable you are speaking with that person, right? Rapport and comfortability is a big piece to therapy. So making sure that when you're speaking to that therapist that you feel heard and understood. Like I mentioned a little bit earlier, making sure that the therapist provides evidence-based treatments. You might not know exactly what treatments are especially when they say things like cognitive behavioral therapy or acceptance therapy, but writing them down and doing some research later is always a good idea. And honestly, having maybe getting them to tell you an idea of what to expect in therapy, right? They should have a good elevator pitch. What therapy kind of looks like with them, especially for what you're coming in for. But a big thing, especially, a big thing to hone in on is, can this person help me? And has this person helped people similar to me?
Your website is thrivingcenterofsight.com. Is where people can go to find out more information. I know you have these locations, but because you're doing telehealth, are you accepting patients from any location or only in the cities you currently are serving?
So the states that we're currently serving, we're adding on Illinois and Massachusetts very soon, I think next month. So just the states that we're in it, but if you do prefer in person, just the cities, which are the large metropolitan cities in these states. So New York City, Miami, Los Angeles, to name a few.
That makes sense. No, I appreciate your tips tonight. It's interesting. One question I have for you as we kind of wrap it up, because there's all this, you talk about negative stigma. I think Hollywood kind of plays into that. So what's the average length like? Got about 30 seconds. So people, are they with a therapist for life? Is it with a season? Or does it depend on the patient?
It definitely depends on the patient. I would say, on average, what we see, and this is different between practice and practice and what therapeutic modalities people use, but we see an average about 12 sessions. People usually overcome what they're originally coming in for.
All right.
After that, it's preference. There's a lot of people that like to come. Sorry.
No, I just appreciate you clearing that up. I'm up against the clock, but that's good information. Thank you so much. Stick around. We'll have more coming up right after this.